Hello everybody, and we are back at discussing remedies from Dr. N.M. Choudhuri's Materia Medica, and today we are going to talk about the remedy Colchicum Autumnale. Okay, so as I have already told you, Dr. N.M. Choudhuri starts by discussing little basics about about any remedy that he talks about. So while discussing about Colchicum, he tells us that the common name of the remedy is meadow saffron, and it belongs to the family Liliaceae. It's a biennial plant which has an active principle colchicine, which is extremely bitter and poisonous alkaloid. So this is a poison. So if it's taken, there will be symptoms produced, right? There will be poisoning that will happen. So now further he discusses about the symptoms of poisoning that happens. First of all, it tells us that it is like this is a white, yellowish, amorphous powder. Okay. It is soluble in water, in acid, spirits, ether and chloroform. Now he mentions a very important point which you should remember. So now it is this white powder of colchicum is frequently used as an ingredient in many quack medicines sold in the market for the cure of gout of rheumatic affections. Okay, so it's this remedy or not this remedy as in homeopathic remedy, but the crude form of colchicum, which has this active principle present in it, colchicine present in it in crude form, is actually used by many quack doctors. Okay, the people who aren't doctors but like still they prescribe. Okay, those people will have this few herbs or something with them, and this powder is also been given by these patients for the cure of gout or for the rheumatic affection. So remember this. Okay, this is a remedy. The remedy is used in this crude form for gout. Right, so what is gout? You know gout? Gout is when your great toe gets swollen, when basically your uric acid increases, okay? And that is why this uric acid, when it increases in your blood, the crystals are formed and these crystals of uric acid get deposited on your joints, okay? So on your small joints. So basically most commonly it gets deposited on the toe joint, okay? So great toe will get affected. It will be swollen and very tender. It will be congested, swollen, inflamed. So that all, there are many stages in gout also, so that we will learn. But basically this remedy has been used for gout. That is what we have to remember. And now what is the toxicology? So when anybody takes it like not in a normal like quantity, so 25 to 30 minims is a lethal dose. So whenever anybody takes it near to this amount of dose, then they will have poisoning, right? They will have symptoms of poisoning, and this is a very slow acting poison, right? This is a very slow acting poison, and there is gradual death after 6 to 7 days of poisoning. So it's not a sudden death, but it's gradual death. Means there will be a lot of suffering before death. So gradual death will be there. Violent inflammation of GIT takes place. So GIT is the affection. So now remember, if this remedy or if this substance in its crude form has all these symptoms, then when you potentize this medicine, this substance, then the medicine will also cure these symptoms, right? That is the law of cure that we are studying about in homeopathy. Whole homeopathy is based on this only. So that is why these symptoms of toxicology are of great importance to us. Also the symptoms of also this point like that we've discussed, that this has been used by quacks for gout, is also very important, because it also shows us that when patient has gout and symptoms colchicine are there, characteristic symptoms of colchicum are present, then it will cure gout. So we've already got two important sphere of actions of this remedy. One is rheumatic affections and the second is GIT. So there is violent inflammation of GIT, there is serious depression of the heart, there is great lowering of the temperature, okay? Abdominal pain is there, it's gripping in nature, okay? Severe nausea will be there, vomiting, diarrhea, great muscular weakness. All the muscles will be very weak. These people will have they will be lethargic because of the weakness in muscles. Severe cramps in feet, calves, stupor, collapse, finally death. Okay, kidneys will also be inflamed. The urine is almost black. So see how violent or the patient must be suffering so much. This patient of poisoning must be suffering so much before his gradual death, right? Now these are symptoms will be there. When you find these symptoms in a patient, we'll also study about the characteristic symptoms obviously. So when you find any symptom with and along with them many characteristic symptoms of colchicum are present, you can always prescribe colchicum and you will not be disappointed, right? So let's start studying about it in detail. When we talk about it, actually, Dr. N.M. Choudhary has mentioned a few characteristic symptoms first of all. So some 5 to 6 characteristic symptoms are present. Okay, he has mentioned them one after another, and he has explained them in detail. First of all, after which he talks about the constitution of the remedy, and then he goes on to the nausea, the qualmishness. So nausea is a very important symptom. We saw this inflammation of GIT, there's severe nausea. It is a very important symptom in this remedy. So then he goes into the depths of that symptom, and he tells us in detail about that symptom after talking about the constitution. And when he's already talking about nausea, he also explains about the cholera symptoms of the remedy, and that's about it. Right now in this video we're going to learn about these symptoms only. After that also he explains a lot more about the remedy, regarding the nephritis of the remedy, regarding the gout or the rheumatic complaints of the remedy, which will all be covered in the next video or in the part 2 video of Colchicum. It will also have nausea of pregnancy, and there are many more symptoms. So right now we'll go to the important characteristic symptoms that he tells us about, the 5 to 6 characteristic symptoms that he talks about, which will be found in every condition of Colchicum. Okay, so whatever disease condition Colchicum has, he must or he has to have those 5 to 6 characteristic symptoms. It is not very mandatory that he should have all of them, but yeah, 2 to 3 at least very peculiarly should be present for us to prescribe Colchicum. So the first very important landmark that Dr. N. Choudhary talks about is the extreme relaxation of the entire muscular system. And now when we talk about this, we have to recall gelsemium. So gelsemium has this extreme, relaxation of the entire. So muscular system पे action है gelsemium का, and it is very, very, strong. Nobody can forget about it. We will also talk about gelsemium in our further videos, but right now in Colchicum this is present, right? Extreme relaxation of the entire muscular system. How do you know? So this is manifested by the constant disinclination on the part of the patient to move or to walk. So this entire muscular weakness, because of this patient will want to just sit down and will not want to move, or will not want to work at all. Sickness in the morning, at noontime, in the evening, and at night. So when is he not sick? So it's morning, noon, evening, night. So all the time he is sick, because he has this entire muscular system wala feeling that there's relaxed, it's all gone. Okay, and the muscles are not so strong. And slightest exertion, even if he has climbed only a few steps, even he is just straining for stool, or even he is just talking, that will give him lethargy, that will give him exhaustion. So there is even slightest exertion. Sometimes this exhaustion is so marked that he sits up. Then when he sits up, so right now if he goes and he sits somewhere, so this exhaustion is so much that when he sits up, then his head falls either forward on his chest or on his back, or as if this is as if he has not the strength to keep it up, as if he has no strength to even keep his head up. This prostration is almost like the prostration of arsenicum, only without the restlessness of arsenic. We know that arsenic is restless, but arsenic is also a major remedy for prostration. So when we talk about the action on muscular system, especially the relaxation of muscular system, we have to remember about the remedy gelsemium, which also has this symptom as a peculiar symptom. And when we talk about the prostration, when we're talking about the prostration, it is like arsenic. So we have to remember arsenic. Arsenic is just restless, that is a differentiating symptom. Arsenic is more restless. Okay, it's restless. Colchicum, it's nothing like restless. In fact, they are so disinclined to even move. They cannot be even restless, because they cannot even just talk, strain for stool, climb a few steps. They're very, 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 very exhausted. So remember this symptom. Okay, it's very, very important, and it's very characteristic, isn't it? The second important landmark that he talks about is the general, mental and physical, both, aggravation from first movement. So even little bit movement he cannot afford. There is a lot of aggravation. You have already seen how exhausted he is. He cannot afford to move even a little bit. He cannot afford to talk, strain for stool. Okay, this exposure to damp, cold, from getting wet, from bathing and living in damp dwellings, this also aggravates him. So even if he gets if he gets wet from rain, or wet, if he's exposed to any kind of damp weather, okay, if he's living in damp dwellings, so if he's living in a room which has which has these walls which have all gotten this wet and damp, that will also affect him. This change, if there's any change in weather, that will also affect him. So this is the second important landmark. There is general aggravation from movement, exposure to damp, cold, from getting wet, from bathing, vagara, from changes in the weather, right? Now, what is the third characteristic? The third characteristic is its great susceptibility to all external impressions such as light, noise, and strong odor. So basically, great external impressions. So whatever external impressions are there, he cannot take it. Then he talks about the fourth characteristic, which is the great nausea and faintness from the odor of cooked food. So especially from the odor of cooked food. This gives them great nausea and faintness. And especially fish, eggs, and fatty meat will cause them this suffering. It will give them great nausea. Okay, especially fish, eggs, and fatty meat. So now, right now, at this point, Dr. N.M. Choudhuri does a very exciting, interesting thing. He actually cites a case which has been solved by Dr. Nash. So let's learn about that case. What is it that Dr. N.M. Choudhuri wants to tell us? So, Dr. Choudhuri tells us that the patient of Dr. Nash was actually 75-year-old male. So, he was an old patient and he had stomach ache as a chief complaint. There was vomiting which contained large quantities of blood. And there was severe purging, okay. Great tenesmus. Tenesmus is the urge, okay. And then the treatment was done by Dr. Nash. He had given aconite, nux vomica, ipecac, hamamelis, sulfur, but none of them helped, okay. They did not help. Even doctors felt that the patient was going to die. That severe the case was. So you can imagine, if the doctors are thinking that the patient is going to die, how difficult the condition must be. He was vomiting blood, right? During all this sickness, the patient had been so nauseated and faint at this smell of cooking food that they had been obliged to keep the doors closed between her bedroom and kitchen, which were two large rooms away. So already the bedroom and the kitchen were large away, right? They were away from each other. And yet the patient had to keep the doors closed because even slight smell of cooking food would make him nauseated. So this was the symptom. Now, Dr. Nash was already talking about this symptom. There's nausea from the smell of cooking food, especially, fish, eggs, fatty meat. That is why he tells us this case, because when this symptom was taken by Dr. Nash, he prescribed colchicum finally, it was given, and the results were most marvelous. Right? So a patient who was going to die, but with this remedy, he was helped. So, you can understand that this symptom is the characteristic symptom because of this reason, because it is so helpful, okay. So whenever you have this kind of symptom and you prescribe colchicum, it has to help, or most of the times it does help if all the other some of the other characteristic symptoms are also present. So see, it did help in this case. So the results were marvelous, yeah, right? So homeopathy is really amazing, and doctors are amazing, doctors like N.M. Choudhuri, doctors like E.B. Nash are amazing, who study so much, who could do this. And this is a dose of motivation that Dr. N.M. Choudhuri also gives us after telling us about this case. He says that yet another reason for citing this particular case, okay, so why did he cite this case, is to impress on all medical practitioners. What does he want to tell us? That the importance of strong determination, perseverance, and patience. Like he wants us to know about the importance of this through this case. Dr. Nash failed. Okay, he failed not once, not twice, but many times, right? He prescribed nux vomica, he prescribed ipecac, aconite, hamamelis, sulfur. He failed, but still he was determined to fight it out. Dr. Nash himself says that he would fight it out on the line if it took all summer. So he himself says that even if it took all summer for him to finally find the real correct remedy, still he would not give up. He would keep fighting. The genius of the man, that is the genius of Dr. Nash, shows out in this strong determination to fight. The repeated failures served only as a fuel to him and showed out the real personality of the great doctor. So this is how Dr. N.M. Choudhuri very beautifully speaks about Dr. Nash, telling us about the importance of this determination, patience, perseverance, not giving up. Now he goes to the fifth characteristic, which is aggravation of all symptoms from sundown to sunrise. So basically from evening to morning. So whenever the sun goes down until the sun rises up. and in this respect it is very similar to lutein. Then there is the last characteristic symptom of colchicum, which Dr. Nensori talks about, is sensation of icy coldness. Okay, sensation of icy coldness over the stomach, and this is especially found in Asiatic cholera. Okay, sensation of icy coldness over the stomach. So, right, until now we've discussed about all the characteristic symptoms, which were 6 in number. The first one was the extreme relaxation of the muscular system, so much so that the patient will like fall in front of his chest or fall at the back. So his head might go anywhere because of the extreme exhaustion of the muscular system. The general aggravation we've seen from movement, from exposure to any damp, okay, from exposure to any damp, from bathing, from living in damp weather, okay, any change in weather. There's great, and all of these, all of these whatever we said about, like there's general aggravation of movement, cold, damp, vagara vagara, all of that can give him anything. It can lead to diarrhea, it can lead to rheumatism. So that is the importance of that symptom. And then there is third characteristic, which we talked about, the great susceptibility which this patient has to all the external impressions, such as light, noise, strong odor. And finally the fourth one, which actually is very very important, so important that it can stand out prominently, and it can practically eclipse all other characteristic symptoms, right? Which means that if this symptom is present, you do not have to have any other characteristic symptom for you to prescribe colchicum. There is great nausea and faintness from the odor of cooked food, especially fish, eggs, fatty meat. Great nausea and faintness. All right. So then we came to the fifth characteristic, which was the aggravation of all symptoms from sundown to sunrise. And finally the sixth one, which is icy coldness over the stomach, especially in Asiatic cholera. So these are the 6 characteristic symptoms of colchicum which you have to remember. So now Dr. Choudhari tells us about the constitution of this remedy. So this patient is like emaciated and a sensitive individual. We have already seen that all impressions will affect him: light, noise, odor. So he is a sensitive individual. He is emaciated, greatly disposed to rheumatic and gouty troubles, which we have already seen. He is a leukophlegmatic and melancholic temperament wala person. Leukophlegmatic, melancholic, okay, very, not very excited or nervous, okay, melancholic, leukophlegmatic. Memory is weak, confusion marks many of his ideas. So you can think about it, like an exhausted person का memory कैसे होगा, और वैसे भी वो exhausted नहीं भी होगा तो this can be seen, okay. Memory is weak, confusion marks many of his ideas. Intellect is clouded and dim. He reads but he does not comprehend what he reads. तो पढ़ तो रहा है but he cannot understand what he is reading. He is surely ill-humored and his suffering seems intolerable to him. So there's a lot of suffering. They cannot tolerate it. They cannot bear it. Lack of desire, mental and physical, obviously because of the exhaustion. His countenance betokens anxiety. He seems to be very anxious when you see him. His face is like that. His expression is like that. He is sad, doleful, and almost cadaverous looking. So he's so like deathly looking, cadaverous looking, sad and doleful. There is circumscribed redness of the cheeks with marked paleness of the nose and mouth. And you can also find this symptom in ferrum mate, especially flushing is very common in ferrum mate. So there is this circumscribed redness of the cheeks, okay, and the other remaining face is very pale. So this is the constitution of this remedy. Emaciated, sensitive person, leukophlegmatic, melancholic, memory wala, confusion wala hai, suffering intolerable hai, lack of desire is there, anxiety wala feel on his face, and cadaverous looking face, is circumscribed redness of the cheeks with marked paleness of other parts of the face. Now, as Dr. N.M. Choudhary goes ahead to talk about nausea, he says that a symptom that has already been touched on, right? We touched it when we were talking about the characteristic symptoms, but which needs a little more explanation is the extreme nausea and qualmishness of the colchicum patient. Okay, there's this extreme nausea and qualmishness. He suffers from constant salivation, and even the swallowing of his saliva will give him nausea. Even drinking of water will give him nausea. So we've already seen one of the very characteristic symptoms, which was the odor or the smell of the cooking food that gives him nausea. And now we're also seeing that this salivation, even if he's swallowing the saliva, even if he's drinking water, that is also giving him nausea. Movement aggravates this patient. We've already seen movement aggravates this patient, because even slightest movement will incite him to vomit. So also if he has even slightest of move, if he does even slightest of movement, he will feel like vomiting. He will feel nauseated. Okay, he is obliged to double up. Okay, he lies absolutely quiet the whole day. Obviously, because movement aggravates, he will lie absolutely quiet for the whole day. He will not even move slightly because he has this fear of nausea. Now, how is the vomitus? The vomitus is watery, glary. Okay, there is glary mucus, and there is turquoise matter in the vomit, which means consisting of or resembling feces. So that is the kind of vomitus that they have. Okay, there's great burning and uneasiness at epigastrium. Whole abdomen is distended with gas as if he has eaten a great deal too much. Plus painful urging to stools is present. Okay, so remember this stercoraceous matter wala vomit is there, watery, glary mucus can also be there. Doubling up will make him feel better, movement will aggravate him. His constant salivation and even the swallowing of his saliva or water will give him nausea. So then he moves ahead and talks about Asiatic cholera. So if these patients have cholera, it's very common, and especially Asiatic. It is called cholera. Is called as Asiatic cholera because there have been many epidemics of cholera which has taken place in Asia. Okay, many Asiatic epidemics. So these attacks generally come on in autumn. Okay, that is why this leaf is there. So these complaints, okay, cholera, especially diarrhea, will come on in autumn. Severe cutting pain will be there about the umbilicus. There will be deathly nausea and frustration. You have seen this type of nausea was also there in poisoning of colchicum, right? We saw it just at the start of the video. So there's deathly nausea and frustration. There's constant vomiting that takes place. Tenesmus in the rectum is long lasting. What is it? What is tenesmus? It is actually the urge to pass stools. Okay, so that urge is long lasting. Agonizing pain is there in the anus. How are the evacuations or the stool? They are very profuse and watery. Plus, there is great abundance of jelly-like mucus. Okay, jelly-like mucus is there, which is floating on the surface. This denuding of the intestinal lining means stripping off of the intestinal lining of the intestinal canal is the most important point to remember. This is seen in the stool. Okay, the stools are very profuse, they're watery, and there will be like this jelly-like mucus will be floating on the water when on this profuse watery stools. Then there's cramps and collapse in this patient. So the cholera, in cholera there is cramp and collapse because in cholera the stools are so profuse. There's rice watery stools and there's so many frequent stools and profuse stools that finally the patient goes into collapse. There will be cramps because of dehydration. So this happens in this patient as well. The urging is very great, leading sometimes to the protrusion of the rectum. So the urging is so great that the rectum might come out with it. The protrusion of the rectum might take place. Sometimes the stools are only full of glary jelly like mucus. So what did we see? Autumn is the cause. Whenever autumn comes, they have these attacks. There's this umbilical pain, there's nausea, which is deathly, prostration, which we have already seen. There's the constant vomiting, tenesmus is there, and the urging is so much that even stools, even the rectum will protrude out with it. How are the stools? They are very profuse and watery. There's jelly-like mucus floating on the surface along with the stools. And what is the jelly-like mucus? It's actually the denuding of the intestinal lining. And in dysentery, there will also be blood present with this jelly-like mucus and the stools of colchicum. Next, we go further ahead. He talks about a little bit about Asiatic cholera. There's tingling, itching, burning, tearing in the anus, oozing of copious mucus. Okay, spasms of sphincter causing shudders, long lasting pain in the rectum after stools, deathly nausea and changeability of stools. So it's almost, we've talked about it. Relief after stools is so great. Now see this, relief after the stools will be so great that the patient falls asleep on the vessel as soon as tenesmus ceases. Means he's sitting on the commode, he's passing out the stools, and the relief which he feels after passing the stools is so much that he will also there's exhaustion, right? So he will fall asleep on the vessel, on the commode itself. That is the severity of his suffering. Okay, so this is all that we're going to talk about in this part. Let's just revise it. So let's revise. So we talked about the first thing that we talked about was the characteristics. First we talked about actually toxicology, but let's start with the main part. So we talked about the characteristic symptoms which were 6 in number. The first one being the muscular system wala, Okay, there was action on muscular system, in which there was great relaxation of the muscular system, right? So relaxation was there, and we revised it. We talked about it in relation to gelsemium. We also know that gelsemium has this symptom very peculiarly present. Second, we talked about the aggravation from, first of all, movement, right? Second, from damp, from bathing in water, like bathing in this being wet, bathing, right? And then we talked about the change in weather, right? Change in weather will also affect them. Then the third characteristic was about the great susceptibility that they have, right? Susceptibility to almost everything. Okay, all, even slightest external impressions, right? Light, noise, odor, all of them, right? Then fourth, we studied about the great nausea, right? Great nausea that we have, especially from the odor of cooking food, right? Cooking or cooked food, whatever. Smell. Then we talked about the fifth point, which was about the aggravation from sundown to sunrise, right? Sundown to sunrise, which is also seen in lutein. And then we talked about the sensation of icy coldness of stomach, right, over the stomach, which is especially seen in Asiatic cholera. Then we talked about the constitution of the remedy, right? In which we said that the patient who is like emaciated, he is very sensitive, right? We have already seen he's sensitive because he has this susceptibility to everything, like light, noise, odor, all external impressions. This memory was, very weak. He was confused all the time. Okay, his intellect was clouded. He could not understand what he is reading. Okay, suffering was intolerable to him. He has no desire. Lack of desire, lack of, so lack of desire is there. Okay, his countenance is of anxiety. He's very sad, cadaverous looking, and he has this, circumscribed redness of the cheeks, right? Then we went on to learn about the nausea. So talking about the nausea of the remedy, which is a very, very, very characteristic symptom of this remedy. First of all, it tells us about even swallowing a saliva which is constantly, they are getting produced, will give him nausea. Drinking water will give him nausea. Movement will aggravate, right? Movement will aggravate, which is already seen actually in characteristic symptom. When he doubles up, he feels better, right? Doubles up will feel him better. His vomitus is like a containing of this stercoraceous matter, right? Vomitus has stercoraceous matter, which is also, it also has glary mucus, and water is also there. Like great burning is there in the epigastrium. Whole abdomen is distended with gas. Okay, painful urging to stools is there. Next we see talk about the Asiatic cholera, right? Asiatic cholera, in which we find that this patient has complaints in autumn, right? There's this deathly nausea, prostration, constant vomiting, tenesmus, which is very, very, strong and long lasting, right? The mucus, the stools are very important. The stools will contain jelly like mucus, and they are very profuse, right? Very profuse stools, watery stools. And there's cramps, there's collapse. The urging is so much that urging can also lead to the protrusion of rectum. And the relief which is obtained after stools is so much that the patient might fall asleep on the vessel itself or on the commode itself, right? So this is basically is a summary of whatever we learnt about, and in this part we'll talk a lot more about colchicum in the next part. So I hope you read about it from N.M. Choudhari's Materia Medica. Thank you and goodbye.